Good afternoon. This morning we will be talking about pneumonia. Um, as pneumonia can be a very serious and life-threatening disease. Pneumonia is an infection that inflames the air sacs in one or both lungs, in which they may fill with fluid. These air sacs are called alveoli, and they are located in the lungs and passages in which they may fill with mucus or pus. Um, like mentioned earlier, pneumonia can be very life-threatening for young children and seniors over the age of 65. Symptoms include excessive coughing, wheezing, fatigue, coughing with film or pus coming up, fever, chill, and difficulty breathing. Some people see difficulty breathing going along with wheezing. However, for some cases, some people who contract pneumonia may feel pressure on their chest, um, causing them to breathe more labored, but not necessarily wheeze. In order to diagnose pneumonia, there are a few things that can be done. For example, a blood test. Blood tests are used to confirm an infection and try to identify the organism causing an infection. However, precise identification isn't always possible. Um, Blood tests are good in terms of determining if you have pneumonia and if there are those harmful bacteria in your blood. Um, However, it isn't always necessary um, when trying to diagnose pneumonia. Um, Another way to pinpoint and diagnose pneumonia would be a chest x-ray. Um, this helps your doctor diagnose pneumonia and determine the extent and the location of the infection. However, it cannot tell your doctor what kind of germ is causing the pneumonia bacteria. Um, Chest x-rays are good in terms of seeing pneumonia in your chest and seeing the mucus fill your passages. However, many doctors also just determine if you have pneumonia based off of listening to your breathing in your lungs using a stethoscope. Um, they're able to quickly determine what the problem is and where it may be. They don't necessarily know the specifics in terms of the bacteria that caused the infection, how it occurred, and where you got it from. However, they are able to determine the diagnosis and what you have, and if you have pneumonia, based off of listening to your breathing using a stethoscope. Um, to treat pneumonia, there are different types of treatment, such as antibiotics. These medicines are used to treat bacteria and pneumonia, and it may take time to identify the type of bacteria causing the pneumonia and to choose the best antibiotic in order to treat it. If your symptoms do not improve, your doctor may recommend a different antibiotic. A general antibiotic may not be the best way of tackling everyone's pneumonia. Um, in order to treat the pneumonia as best as possible, the doctor may do further tests in order to get a more specific bacteria in order to um, prescribe a more specific antibiotic for your case. Um, a more general way of treating it would be using cough medicine. This medicine may be used to calm your cough in order so that you may rest and that your body may naturally fight the bacteria infection. Coughing can help loosen up the movement and fluid in your lungs. Um, so it is not a good idea to eliminate the cough completely. However, it is good to neutralize your cough in order so that your body may rest and that you may treat the disease on your own. A good way of completely um, preventing getting the disease will be in this video shown.
Preventing pneumonia is very important during your recovery. You can help prevent pneumonia by following these simple steps. We use the acronym ICOUGH to help you remember. A nurse will give you the ICOUGH card to review. I stands for incentive spirometer, the device that helps you see how deeply you're breathing. Take a breath. Now place your lips around the mouthpiece and slowly breathe in, as if you were sipping liquid through a straw. Control your breathing to keep the beat between the two blue indicator arrows on the right. Continue inhaling until the large plunger reaches the goal marked by the blue indicator arrow on the left. Repeat this 10 times each hour. C stands for coughing and deep breathing. Deep breathing means to breathe in through your nose slowly for 3 seconds, then slowly breathe out through pursed lips. On the third breath, cough instead of breathing out. If you're in pain, splint with a pillow while you're coughing. Repeat the sequence 3 to 4 times every 2 hours while you're awake. O stands for oral care. The nurse will give you a special mouth rinse twice a day. If you brush your teeth, it should also be followed by the mouth rinse. U stands for understanding. Be sure that you understand all of the information that the nurses give you. Always ask for clarification if you have any questions. G is for get out of bed. Be sure to ask for help getting out of bed or into a chair if you need it. H stands for head of the bed elevated. Elevate the head of your bed at least 30 degrees. Our goal is for you to be able to go home as soon as you can. Preventing pneumonia is a big part of that. Follow the I-cough steps as recommended and always ask a nurse if you have any questions.
And as you can see, pneumonia is very serious for elderly and senior citizens. If we could prevent pneumonia, then we can save some lives, perhaps. Thank you for watching my presentation, and you have a good rest of your day.